Hi, I'm Dr. Katie Belesne. I'm a board-certified dermatologist in both Canada and the US, and I currently practice in Vancouver, Canada. Lips, of course, are one of the most prominent and noticeable features of your face, and just a small change can go a really long way to adding beauty, giving a more youthful appearance, facial balance. Today, I'm excited to share how I craft naturally beautiful lips using Restylane Kiss. When evaluating the patient before any procedure, I like to use the art structure: assessment, anatomy, rheology, and technique. I always start the assessment by evaluating the patient's treatment goals. Patients may have goals such as increasing lip volume or correcting proportion or symmetry issues. And after we discuss those goals, we'll move on to determine the aesthetic need. So before I dress the lips, I evaluate the face as a whole to make sure that the lips will look natural and proportional in context. I examine the perioral region and the surrounding areas, including the cheeks, the nasolabial folds, and the melomental folds. And I also look at the cutaneous lip and assess for any perioral lip lines. Next, I look at the patient's lip movement, and I may ask the patient to smile, purse their lips, pucker with a kiss, or say a phrase, and that can help me evaluate them. Next, we get to evaluate the lips themselves. I look at the vermilion or lip body, the vermilion border, the cupid's bow, the philtral columns, as well as the oral commissures. So we reviewed our treatment goals today with our patient, and our main goal is really to work on a little bit of definition of her lip. In particular, you can see that on her right side, the peak of her cupid's bow is just a little bit lower, and so we're going to work on a little bit of definition structure to bring the right side of her cupid's bow just up a little bit. And then we're also going to be working on global volumization, enhancing her lips just slightly to create a natural but beautiful aesthetic. She's quite young and looks great, and her lips in proportion to the rest of her face look very good, and so really we're going to be focusing on a lip enhancement today. One other thing that we discussed today is that when she smiles big, she does have a bit of a gummy smile. And so by enhancing her upper lip with a bit of volume, that may reduce some of the gummy show that she has. It's important to understand the vascular anatomy. One of the most serious potential complications is filler being injected into a vessel, which could lead to loss of blood supply to the lip or to the surrounding tissues. The high-risk vessels that we need to be aware of are the superior and inferior labial arteries. And these arteries tend to run along the vermilion border within the red lip and are typically deep in the submucosal plane. It's also critical for all injectors to know what to do if you experience a complication. Restylane Kiss is firm enough to provide structure and volume. However, it's made from expression technology, which is flexible, and it allows for natural expression in areas of animation and movement, like the lip, for example. I've found that some of the softer lip products, when I inject them, they can almost bleed into the surrounding cutaneous lip or the upper lip. Restylane Kiss, on the other hand, really stays where you put it. It's firm, but also flexible. When I'm injecting to work on the structure or shape of her lips, which I talked about particularly for this right upper lip, I tend to inject using a needle just along the vermilion border. Usually I'm using little antegrade or retrograde threads along here, and I'm being very precise and conservative with my volumes. When I move to volumization of the lips, there's many different techniques that can be used, and I think what's most important is knowing the location of your product as well as the amount of product. But today what I'll demonstrate is doing a little bit of a vertical strut of product coming perpendicular to the lip, and I will be injecting along here to provide some volumization to the lip. On her lower lip, I'm going to demonstrate a bit of a fanning technique where I'm going to again come perpendicular to the lip, and in this case I'm going to focus on those tubercles that she has, which are the natural areas of prominence. I'm going to start by working on her vermilion border on this side to bring this side up, and so when I'm doing this, we're just doing small injections just along the border and just a little bit of pressure. And I'm doing little antegrade threads. You can actually see the product moving along, and a tiny bit of a retrograde pull back to help enhance the definition there. And you can see, even just at the peak of that Cupid's bow, you can bring that up just a little smidge. This one stings a lot. You're doing so good. But I'm bringing that up. And I also often just help to feel the product and pinch. And you can see we've now brought that right side up just that little bit to help balance the two sides. I'm now gonna work on a little bit of definition on her lower lip. And so just some nice deep breaths. And I'm gonna start just in the midline. Help to enhance the lower border and definition. And she doesn't need much here. I'm going to mostly focus on volumization as opposed to structure in this region. Come around to the other side. You're doing so good. So deep breath, and same thing, I'm just doing a tiny bit of enhancement of the border on her lower lip, just to make sure we have a little bit of structure. You can see just tiny little retrograde threads. And we're gonna move from there to working on volumization. So I'm gonna start where her natural tubercles are, and I'm gonna just start just over here. I'm gonna get a little pinch, and then a little bit of product coming up. And just keep breathing. And one more little poke here. Same thing over here, and little poke. When I'm approaching my injection technique, I'm really thinking of anatomy, how to do it safely, knowing where those arteries are, injecting slowly, moving my needle tip constantly while injecting are some techniques I employ to make sure we get the best outcomes for our patients. Excellent, how are you doing?
Good.
Now I'm going to demonstrate a bit of a fanning technique to help with volumization of her lower lip, focusing primarily on the lower lip tubercle. So we're going to start in a little poke here. And so I'm moving my needle with the injection. I'm injecting slowly. You're just going to see a little bit of a fan. And this just helps to avert the lip, but it's more of sort of a fanning and bolus technique. Great job. Okay, and it just helps to bring that lip down just slightly. Gonna move over to the other side. And then again, just pushing in slightly, moving my needle, and just a slight fan to help volumize and evert the lower lip. Okay. Take a look again. Beautiful. The goal of any lip enhancement is to have balance and harmony for the lips and the face to have a natural and lasting result. A proper aesthetic evaluation, along with using the right filler for the right part of the face, is important to restore and rejuvenate this very important part of your face. I think if safety and natural looking outcomes are top of mind, we can craft naturally beautiful lips using Restylane Kiss.